There are a number of policies relating to simulation that are in effect at all times. Policies related to confidentiality, consent, and participation. Violation of any of these policies is a violation of the Cypress College Honor Code as outlined in the Department of Registered Nursing Student Handbook and will lead to consequences for the student. By participating in simulation, 1, you agree to maintain strict confidentiality regarding both your own as well as others' observations and performances. The rationale for this policy is to preserve and maintain a safe learning environment, free from allegations of defamation of character or threats of retribution. 2, you agree to keep all details related to the scenarios confidential, including preparation assignment answers, scenario patient history, assessment findings, interventions, etc. The rationale for this policy is to maintain the integrity of the scenarios so that students can all participate in a novel experience that is low stress. This is analogous to abiding by HIPAA guidelines. 3, you authorize the AV digital recording of simulation sessions and debriefing sessions which are strictly used for educational and/or research purposes only by Cypress College, the Department of Registered Nursing, the Clinical Simulation Coordinator, or by RN faculty. You are aware that photography or recording using any type of device by students is prohibited. You may be photographed, videotaped, filmed, or recorded for use in any print or electronic media for the purposes of RN program marketing and publicity for current or subsequent development projects without compensation. The rationale for this policy allows for recording of simulation and debriefing sessions for educational use, which allows participants involved to examine their own performance and allows faculty involved to work with those individuals to recommend remediation if necessary. Recording may also be used for simulation program improvement or development of scenarios, and for research purposes where student participants are not identified. 4, you agree to follow all simulation participation policies. The rationale for this particular policy is that these policies cover a number of points to provide for a more realistic experience, also to protect and maintain the high-tech mannequin, and to address student safety. You are responsible to know and adhere to the following simulation participation policies. This document is posted outside the clinical simulation lab, as well as posted on the Skills Lab course info on My Gateway. The first policy is 1, strictly adhere to all confidentiality, consent, and participation policies, and these we have previously discussed. 2, preview orientation materials, practice sessions, and videos prior to attending simulation. 3, professional dress is required, so wear your uniform. 4, bring standard equipment such as a stethoscope. 5, bring a completed prep assignment with you in order to participate in the simulation session. This completed assignment serves as your ticket to participating in simulation. 6, be on time. If you are late to your session, you may not be able to participate. 7, do not use cell phones, pagers, Bluetooth devices, participate in texting, or use any other electrical device. These interfere with the wireless network that we maintain in the Simulation Center lab. 8, leave all personal baggage at the door and be ready to learn. 9, be accountable for all previous knowledge, skills that you have learned. 10. Maintain respect for self and others. 11. Relax. Simulations are not graded. 12. Enjoy, engage, and participate in the process. Be open to role-playing and new experiences. 13. Expect to make mistakes and learn through them. 14. Participate. If you do not participate, you may be asked to leave. 15. Strictly adhere to standard safety precautions for students and staff and mannequins and patients, such as body mechanics and electrical safety. 16. Adhere to standard precautions, such as hand hygiene or isolation procedures. 17. Exhibit professional behavior while interacting with peers, faculty, and the patient. Help each other. 18. Students are to follow established standards of care and utilize the nursing process during simulation. 19. Return mannequin, equipment, supplies, and the environment back to baseline. 20. Strictly follow all policies relating to the human-patient simulator use. And there are a number of guidelines as far as using these high-tech mannequins, and let me review some of them. What you need to do is treat the mannequin as you would a real patient in a real environment. Again, to reiterate, all cell phones must be turned off. Cell phones that vibrate, are placed on mute, or powered on can interfere with the mannequin functioning. Human patient simulators are not to be used for task training experiences, such as IV insertion, NG tube insertion, urinary catheter insertion, etc. In the Health Sciences Skills Lab, we have separate task trainers that you may use to perform those types of procedures and practice your skills. State aloud that you are inserting an IV. Go through 2 forms of patient identification and initiate the 5 rights of medication administration as you're working with the patient simulator. You won't actually insert an IV catheter. You will verbalize that you are inserting it, and you will verbalize the patient identification as well as the 5 rights. If you need to calculate the dosage of a medication, you certainly can use the calculator provided and paper and pencil to work up your calculations and check them with your fellow students. An IV pump is available on an IV pole in the room, and you will verbalize what you would set the pump rate for. You don't actually have to turn on the pump, just to verbalize. There is absolutely no food or drink in the clinical simulation laboratory, and this is to protect the high-tech mannequin. Also, no pens or markers. Pen marks cannot be removed from the mannequin's skin, so pencils are provided for your use if needed. No betadine solution is used with the mannequin, and neither are any sort of blood solutions, because they permanently stain the mannequin's skin. Another point, do not place oral medication or oral liquid into the mannequin's mouth. This is a patient simulator, and it does not have the ability to take any sort of oral medications or liquids. Do not actually defibrillate the mannequin. You can go through the actions, but the defibrillator provided is turned off. So if you need to simulate defibrillation, you would place the paddles, and then you would indicate the amount of energy that needs to be delivered, whether it's a synchronized or unsynchronized shock to be delivered, and go through all the safety procedures as you would a regular patient. CPR is allowable, so if the patient is in need of CPR, be sure to go ahead and initiate CPR. And these cover the general guidelines for working with a human patient simulator. This segment covers simulation session basics. Prior to simulation, all preliminary preparation is completed. A typical clinical simulation session runs about 20 minutes. Each student will receive a randomly assigned role that they will be required to role play. Available roles vary depending on the specific learning objectives for that scenario. Examples of roles include primary RN, staff RNs, charge nurse, family member, observer/recorder, and patient care assistant. The clinical simulation coordinator role plays other roles, namely the patient's physician or primary caregiver, as well as various ancillary healthcare professionals. The primary RN can reach any of these healthcare team members by telephone from the patient's room, as well as at the nurse's station, which is where I'm seated. In addition, the coordinator runs the human patient simulator. The clinical faculty member observes the simulation and may make notations during the experience. He or she facilitates the post-simulation debriefing process. At the beginning of the simulation session, you will receive report about your assigned patient from the off-going primary RN. There is a pre-printed SBAR provided. You can take additional notes with a pencil and pad of paper. All material provided, as well as notes taken, must be returned to the clinical simulation coordinator at the conclusion of the session. You may or may not initially be provided with physician orders. In some simulations, the primary RN will need to call the physician to obtain initial and additional physician orders. The primary RN then prioritizes the orders and delegates implementation to other team members. Carefully consider what needs to be done, then perform or delegate those tasks, such as taking vital signs, looking up medications, calculating dosages, administering medications, or performing various procedures such as administering oxygen or inserting a urinary catheter. Even performing a focused assessment or comforting a family member. Work as a team and follow up appropriately. The student observer/recorder uses the Observations of Simulation Experience form. This form is available on the Health Sciences Skills Lab course on MyGateway. Certain aspects of patient care occur in all patient encounters, involving communication, teaching, infection control, safety, comfort, assessment, interventions, gathering diagnostic data, interpreting that data, and implementing a plan of care. Not all items listed will apply. Findings from this form can be discussed in the debriefing session, so be sure to review the form in detail prior to simulation. Post-simulation debriefing takes place immediately after the simulation session. The clinical faculty member will secure a location for students to assemble to discuss their experience. Simulation is not graded. We want to create a safe, non-threatening learning environment for you.